Good morning, and welcome to the Brenda Perryman Show right here on TV 33 WHPR Comcast 90 in Oakland and Livingston County, and Comcast 91 in Detroit, and all over the world, courtesy of the World Wide Web, of course, at www.tv33whpr.com. And of course, we have an app for your phone. We are all over the place. You could catch us even in places you don't want to catch us. You can catch us. And I want to first announce I had a video interview with Kristen Chenoweth, the actress, and we'll have to run it next week because it's off my queue right now. So I'll just run it next week. It was a pleasure talking to her about breast cancer, and I'll just run it a week late. Don't worry about it. You will see it. And also, I have a great show for you today. My second segment is entertainment with Collective Peace, and I'm so excited to interview these two young people. And my first guest I'd like to interview is wMaceo Coleman. Good morning.
Good morning, Miss Perryman.
How are you? You could call me Brenda.
All right, Brenda.
I think Miss Perryman is my nickname. You know, a lot of people call me BP, but I can have friends who call me Miss Perryman. They old as me and calling me Miss Perryman.
Well, it's a respect thing.
Oh, thanks.
All right.
Thanks. Also, everyone, remember we're doing Table Talk right after the show, and we're going to be talking about the young lady who was manhandled in South Carolina. And as a former teacher, you know I really want to talk about that. But the PACE program is very, very important. Why don't you tell the audience what you do with the PACE program?
Very good. I'm a community outreach liaison with PACE. PACE is a program of all-inclusive care for the elderly. It's a Henry Ford Health System program in partnership with the Presbyterian Villages of Michigan. It's been around for over 20 years in the community, formerly called Center for Senior Independence. So the name changed in March. But the program is geared towards keeping seniors 55 years old and older. That's a young age for seniors, but you know.
Wow.
Yeah, 55 years old and old.
I've been a senior for a minute.
But that's all right.
According
I'm not
to
there
you
yet.
all.
Hey.
According to you. Oh, you don't have to say you're not there. You're
Well,
a
I
man.
mean, it's all right.
But that's okay.
Looking forward to it.
We can pass
Aging
this.
gracefully.
Yes.
Well, with the program, we want to keep seniors aging safely in their homes, in the community, out of nursing homes and hospitals. So that's really the goal of the program. It's a Medicaid, Medicare paid for program.
So let's talk a little about what they offer.
Yes. Well, the program has day health centers. We have three. We have one at 7800 West Outer Drive in the Southfield Freeway. We have one inside the Rivertown, Presbyterian Village Rivertown Assisted Living Facility at 250 McDougal on the south side of Jefferson.
Yeah, I've seen that. That's
Okay.
really nice.
Oh,
It's
man.
kind of new.
It is very new, about 2 years old. Beautiful.
What does it take to move into that place?
Well, we don't work with moving in. It's a
Oh.
waiting list. We just have the day center on
No,
the first
I
floor of
saw
the
it.
assisted living.
Somebody, I had a friend who was considering that.
Okay.
And they asked me I didn't even know where it was.
All
And this
right.
was a few weeks ago, and they said, let's drive around and see it. And it looked real good.
Oh man, beautiful. It's two buildings. It's independent living and assisted living. And PACE has the first floor of the assisted living.
Oh, that's
So
great.
yeah, it's wonderful. And then we're having a ribbon cutting for our third location in Macomb County on Shaner between 12 and 13 miles.
So these centers, these health centers, seniors come to them?
Yes, we have transportation that will pick the seniors up. And the seniors that are in this program, we call them participants. So we have transportation that will pick them up from their homes. The average person comes 2 to 3 times a week. We have recreational activities. We'll feed them breakfast and lunch. We also have physical therapy and occupational therapy that's available. And we have clinics that are at each location, staffed with a physician and nurse.
So how many times a week can the seniors come?
Well, technically, someone could come 5 times a week, could come every day. Most people don't, you know,
Right.
just for social activities or physical therapy or things like that. They'll come, the average person, 2 to 3 times a week.
And I see you have medical specialists like women's services, optometry. So people can get an eye exam?
Yes, they can get any medical services that they would get otherwise. What happens with the PACE program, it's a comprehensive health insurance. So whatever insurance a person has, whether it's Medicaid, Medicare, their insurance would convert to PACE. So at that point, PACE would be the provider and payer of all services. So a person that got into the PACE program, and it's also income-based as well because it's paid for through Medicare and Medicaid, their income couldn't be over $2,199 a month, whether that's pension, Social Security, disability, and they can't have more than $2,000 in assets. So that means no more than $2,000 in the bank.
Right. So let's take it, let me give you an example.
Okay.
Two seniors, a couple living in their home or apartment.
Yes.
How can they benefit? What, they're older, they don't maybe get out much or do much, but how can they benefit from this program?
The great benefit for seniors would be, for that couple, would be social activities. That would be one. That would, allow them to get out of the house. They could go on separate days if they needed to get away from each other. They wouldn't necessarily have to go together.
Sometimes that happens, I guess.
Right. They wouldn't necessarily have to go on the same days. And so with that, we would have the transportation that could pick them up and bring them. And there's no copays or deductibles. So if they have copays, for their office visits at the doctors or their medication, copays are high and things of that nature, it's a good opportunity for them to save money. If they have...
Can't save too much, though.
Yeah, that's right. And if they're not driving, if they don't drive, we will provide transportation to all their medical appointments.
Now, does the PACE program offer services that can bring a medical person into the apartment?
Very good. Yes, we do provide home care services as well.
Now, what do those home care services include?
Well, we have certified nurses assistants that can come to the home and provide light housekeeping and things of that nature.
How many days a week?
Roughly 2 to 3 days a week.
Okay.
And so those could be the days that they don't attend the centers.
Okay, they can do some light housekeeping.
Yes.
Okay, do any medical people come out?
We can have a visiting physician if they are unable to make it out of the home.
Oh, okay.
Yeah.
Now, unable is like what?
Bedridden.
Okay.
Yeah,
I see.
we do have people that are bedridden and unable to get out of the home. So we are able to bring those professionals to them.
If you have any questions about this, you could give Mr. Coleman a call right now. So I just want to put it out there because this is something that I believe is good for seniors who don't have they don't have a whole bunch at the bank, but they want services, they need some services, and socialization. To me, socialization kind of keeps you alive.
That's true. Staying at home can be very depressing. And if you've outlived most of your friends, and you don't have a lot of people to relate with you, at that point, it's good to get out and relate with other seniors and individuals your age.
So what kind of activities do they have?
Well, some of the activities, they have senior proms, so the seniors dress up and party. We have a DJ that comes and plays music for them. They do karaoke. They have bingo. They play cards. They go out on outings. They have picnics. So there are a number of activities that the seniors are involved in.
Oh, that's great. Now, it's mentioned that you have social services. What are those?
Well, we have social workers
on
site that manage the case and will work with the seniors in the event of any situations that they have going on at their homes, making sure that they stay Medicaid qualified and things of that nature. So we have social workers are very resourceful.
Oh, that's great. I mean, it's like you all have so much to help people and you come out to their home if it's necessary.
Yes.
Because some people, they take their parents' keys away. I had to take my mother's keys away. And she was, what was she when I took them away?
What, the car keys?
Yeah,
or the house keys?
The car keys.
Okay.
The car keys in '94. I had to take them away. I said, you cannot drive any longer.
That's true.
Right.
Yeah. So with that, like I say, we do have the transportation.
perfect. Do they have to pay for that?
No, there's no out-of-pocket expenses, and that's the beautiful thing about it. We have with the two day centers, the day health center on the west side and the one on the east side. We have over 400 people participating,
Oh,
and
that's great.
and no one private pays. There's a private pay component if a person doesn't qualify for Medicaid or Medicare. But no one private pays in this program.
Well, what's the difference between the PACE program and having someone in a nursing home?
Well, I guess one of the big differences is you can't join PACE if you reside in a nursing home.
Right,
Yeah.
right.
So you have to be living in your home in the community.
But I was just saying, if somebody's trying to make a decision for their loved one,
Okay. Well, the good thing about PACE is we want the people to remain in their homes, and the government feels it's a better quality of life, and it's also more cost effective.
well, don't they say if seniors stay in their home, a lot of times they live longer too?
That's true. I mean, a lot of people would be more happier staying in their homes as opposed to living in the nursing home. And the nursing home, they're limited to the activities that they can do. There's not a lot of out of the building outings planned. And being able to socialize in your own home, come and go as you please, makes your quality of life a whole lot better.
Right, right. So if I'm making that decision, I think about the nursing home. But medication, that's another thing that
All
I
right.
meant to ask you. Now, is there a nurse or somebody who can maybe in-service these seniors on how to how they should set their medicine out or something? Because that's one thing. Sometimes they can forget about taking their medicine.
That's true. And that's a big issue with a lot of seniors. They either forget to take their medications or they're non-compliant with them, and then that lands them back in the hospital. We do have our registered nurse case managers that will work with the seniors in regards to their medications. We also have pharmacists on staff.
Oh, do you?
Yes, that will work with the seniors as far as their medications, and looking at everything that they're taking. Sometimes they're being over-medicated, or they're taking medications that have been prescribed by different physicians that are conflicting with each other. So our pharmacist is able to look at their prescriptions and make a determination as far as what they're taking and things of that nature, and like you said, in service and educate the family and the participant as well.
Now, what if a person is on oxygen or needs a wheelchair, something like that? How can PACE help them?
Well, that's an excellent question, and I'll answer it this way. There are automatic medical qualifiers for this program. PACE will provide the oxygen. They'll provide any durable medical equipment that's necessary as well, no charge, no copay or deductible. But if a person is on oxygen, has dementia, or if they are on dialysis, then
Well, if they had dementia like that, they wouldn't be in their home, would they, or what?
well, there are caregivers that have patients, or their loved ones in the home that do have dementia. Now, I mean, I'm sure
I mean, to what degree?
well, I've heard some stories,
Oh.
and there have been some advanced, levels of dementia, to, possibly dangerous levels where people have been very, very persistent in, keeping their loved ones at home, and it was probably, guilt that was involved as far as sending mom or dad to the nursing home, and so, people keep their loved ones at home with advanced states of dementia, and sometimes parents wander. Dementia patients can wander out the home, and I'm sure you've seen it on the news.
Yeah, I have, and I get police reports every day, so I know.
Yeah, so PACE is a great program. We have Friendship Park, which is another component of the PACE program, and that's where we work with our dementia patients. So if you have a family member that's has dementia and is 55 or older, you like them to remain in the home, then it would be great to contact PACE.
Now, it says on here, inpatient hospital and nursing home stay. it says it's provided. What does that mean? It's under the services that are provided. It's right here.
Well, inpatient and nursing home stay, what that would consist of is if there is a necessity for a person to go into the hospital, then they'll go into the hospital and PACE will be the provider.
Right.
And nursing home stays, a person is eligible for respite once they participate in the program. So respite will give their loved one a break, from their loved one being at home. And so at that point, the participant would go into one of our contracted skilled nursing facilities for a period of time.
Oh, okay. Because I look at someone like my mom. She can no longer walk.
Okay.
I guess she walked too much in life. No, seriously,
All
because
right.
after my mother was a nurse, and then after that, she was just always walking, walking, walking. And then even in her 90s, every day she was getting on the exercise bike.
Oh, man.
I mean, she was using the heck out of her legs. I think she used them up, really. And
All right.
so she did physical therapy trying to walk, but she can't really get around.
Okay. All right.
Because I would have wanted her to stay with me.
Okay.
And but you have to help her go to the restroom.
All right.
Even though she's very aware.
Good.
So I think in maybe that case, I guess I couldn't do it. I guess I really couldn't do it there, but I think that program, because I think I remember it, but my mother got sick and I couldn't, so I had to put her in a nursing home.
Okay.
But I would have loved something like this. This would have been really up our alley. Really, really, it would be up our alley. I wanted to ask you some more. Oh, yes. Eating, food, nutritional counseling.
Okay.
That's very important that they eat right.
Yes. And we do have dietitians on staff as well. So a dietitian will work with the family, putting a diet plan together. If a person is low sodium or has diabetes or things of that nature, daily plan can be put together by a dietitian for them.
Okay, if this couple can't get out, and they can't get out and grocery shop.
Okay.
Grocery shopping is a task.
That's true. It can be.
It's a task. So I'm sure they probably don't offer any services or somebody who could help them with the grocery shopping if you got me in the store, I could tell you what to get.
Right.
But you know what I'm
Right.
saying.
Yeah, PACE doesn't provide anyone that will take you to the grocery store, though.
So you have to have a friend, people.
Yeah, you gotta have a
have to have a
friend.
friend.
Or a family member. And let me also add that to belong in the program, you can't have a chore provider. There are people that have Medicaid will pay for a chore provider.
What?
Chore provider.
Oh, chore provider, someone who cleans?
Someone who's supposed to clean and cook and do some other things
Cook?
for you. I mean,
This program's starting to look good to me.
Well,
No,
that's a
but-
chore provider. That's not PACE. But what
Oh.
I'm saying is if you have a chore provider that's being paid for by Medicaid, you either have to give that up to get into PACE, or if you decide to keep the chore provider, you can get in the PACE program with it.
Oh, okay.
No, you don't have your own private chef now. Yeah, I know.
I want one now.
Oh, it'd be wonderful.
I used to cook every day. Think about women who used to cook every single day for a lot of years, and then I gave it up.
Oh, I understand. That's where my wife is right now. She's complaining about cooking. So every day.
Already?
Yeah, already. She's been cooking a long time. So I do chip in. I like to cook.
Oh,
and then
good.
we've got a teenage daughter at home. So, we pry her away. We have our days so everyone contributes to what we're going to eat for dinner.
My daughter always says she's been cooking since she was 12.
All right.
I said, Lord, do you mean?
Well, good for you.
Well, I did the main cooking.
Right.
Now, I notice you have all these medical specialists there, the optometrist, the cardiologist, podiatry, and that's very important, especially to people who have diabetes,
That's
isn't
true.
it?
That's true. If a person needs podiatry, their foot care, dentistry, or their eyes checked, they can come to the clinic. We have a dentist that comes once a month, and then we also
You
have
know,
a podiatrist that
yeah,
comes to the
that
clinic.
once a month thing. Okay, the dentist comes once a month. Say if I have a toothache and I come in there and I have to see the dentist.
Okay.
So does my tooth have to ache for a month to
No.
the next time he comes,
Well,
or what happens
that's
then?
well, we'll call the dentist. And,
Seriously.
no, that's a great question. I mean, if you're hurting and it's an emergency or something like that, what we'll do is we'll call the dentist and have him make an appointment to come in. He has scheduled days where he actually comes in, and so he'll see participants at that point. But there are needs that occur during the month that aren't on the scheduled day.
Well, I notice you have audiology, which mean like the hearing aids and
Yes,
stuff.
yes, we have hearing aids services as well. And I'd also like to say that PACE Southeast Michigan is the name of our PACE program. There are over 8 programs statewide, and there are over 100 nationwide. So within our PACE Southeast Michigan area that we service, there are areas in Oakland, Wayne, and Macomb County.
Yeah, I see the list. I see the list. All these cities.
Yes.
Wow.
Yeah, there are a lot of cities that we cover. We don't do Pontiac, and we don't do Sterling Heights. But it's it's easy to say the ones that we don't do. We do service a number of cities in the Wayne, Macomb, and
Oh,
Oakland
what
area.
makes you choose? I have to ask.
That's good. That's the state will give us the zip codes and areas that we can service.
Oh, that's interesting. Now, this program is connected with Henry Ford Hospital.
This program, PACE Southeast Michigan, is.
Right.
The other programs in the PACE, they're not. There's a PACE in Flint. There's one in Lansing. There's one in Huron Valley, which is in the Washtenaw
Right.
County area, Jackson. So there are other PACE programs, but this particular PACE program is operated by Henry Ford Health Systems and Presbyterian Villages of Michigan. And so another thing about the program is once a person decides that they want to participate in the program, they would have to at that point see Henry Ford physicians. So that's a deal breaker for some people, not for all.
Not for my mother. She insists on Henry Ford.
Well, that's great because the way that it operates is an individual still able to see their primary care physician twice a year for the 6-month and annual visits.
Oh, that's good.
But any other services, they would have to see physicians within the Henry Ford Health System.
So, if the patient or if the PACE person,
Yes.
the patient, has an appointment at the main campus of
Okay.
Henry Ford,
Yes.
are any transportation services provided?
Yes. Our transportation will pick them up and then take them over to the hospital.
Oh, that's good.
And then we'll have an aide that will assist.
Oh,
and
that
accompany them.
is great. You hear that, everybody? That's great.
Yeah, and then after the appointment, we'll take them back home.
Oh, that's fabulous because it's a chore sometimes getting to the hospital.
Yes, it is. I've heard stories where one lady told me that she has to pay her neighbor $20, to take her to her medical appointments, and sometimes the lady shows up, and sometimes she doesn't, and sometimes she shows up late. So she'll actually give herself a raise by not having to employ the lady anymore, depend on her,
Right.
because our transportation at that point picks her up, takes her to appointments, and brings her back.
Well, how would my viewers find out more about PACE?
Well, they can contact us by calling 1-855-445-4554. And the
Wait, repeat that one more time.
sure, the number is 1-855-445-4554.
Wow.
That number
A lot
will.
of fives in there.
Yeah, well, it should be easy to remember. 855-445-4554. That'll get you the PACE.
And if they want to go in to the office, can they go into the outer drive office?
Well, we would prefer that they call.
Oh, okay.
Why would they want to come to the
Oh, I
office?
don't know.
Well, I mean, what we would do, and I'll tell you exactly how the program works. Once we receive a referral through the 800 number, we'll make contact with the patient or the family member. And at that point, what we'll do is we'll have our intake specialists ask them some questions to just make sure that they qualify. they also have to have a what we call a nursing home level of care, which means they can't be too healthy to get in the program. There
Right.
has to be some type of illness, you know. Some has to be going on. And so at that point, once we determine that they qualify financially and that medically there's some issues, whatever the issues may be, then we'll set up a home visit for our nurse and our social worker to go out to the home to make sure that they're safe in the community. We've had to decline individuals because they weren't safe in their homes, and I didn't understand the importance of that until we had a quadriplegic gentleman who was interested in being in the program, stayed on the second floor of an apartment building and could only get down to the first floor if he had someone carry him. So he wasn't safe. And so with that, we couldn't bring him in the program. He was in the process of moving into a first floor apartment, which at that point would have made him eligible. But a person has to be safe in their home.
Right, right,
So
right.
that's important.
Right. Well, this is wonderful, and it's a great program.
Yeah, I call it the best kept secret, even when
And
it
if-
was Center for Senior Independence.
When online, people could get it at www.npaonline. NPA, N is in no, paonline.org.
Yes, and that is that'll give them information regarding the national PACE program.
Oh, okay.
You know, they're
But yours is the Southeast Michigan.
yeah. If they wanted to go online and look at our specific program, they could go to www.pacesemi.org, pacesemi.org, and they would be able to see everything that's going on at the program of all-inclusive care for the elderly, Southeast Michigan.
Well, you hear that, everybody. This is great. This is great because everybody's going to be getting older, hopefully, and you need services.
Oh, yeah, it's a great resource, and we want the community to know because of the state regulations, you don't see any advertising or radio or promos regarding this. So it's a grassroots effort to get the information out. We go to churches, senior buildings. We partner with Henry Ford Hospital. So, you know, I appreciate you inviting me to the program today to get the word out to your viewers.
Oh,
and listeners.
definitely, definitely. I want them to have top-notch care.
Well, I mean, at least they'll be informed consumers.
Right, right, right. I thank you, Maceo, for coming.
Thank you, Brenda.
Oh, my pleasure, my pleasure. So if you have any questions, remember to call all those fives. I'll say it one more time, 855-445-4554. Wow.
Yes.
We'll be back in just a moment with Collective Peace.